Speaker, I'm actually pleased to rise today, but find it difficult to be speaking again to another attempt by the Liberal government to endanger the most vulnerable in our society. Just 4 years ago, after the original euthanasia and assisted suicide legislation came in through C-14, we find ourselves considering legislation that will further loosen restrictions, eliminate safeguards, and confuse our country's understanding of the sanctity of life and the government's role in end-of-life decisions. Once again, we've been told that in order to uphold the charter rights of some, we must endanger the rights and freedoms of others. I didn't support C-14 for many reasons. First, the fact that the Supreme Court of Canada invoked such controversial and flawed legislation that has been proven to be poorly applied around the world. The choice by the Liberals to broaden the scope of the legislation, going far beyond the Carter decision, and the fact that it was placed ahead and continues to overshadow any significant palliative care initiative. In 2019, the Prime Minister promised to expand eligibility criteria, and on September 11th of last year, the Superior Court of Quebec ruled that it is unconstitutional to limit assisted suicide or euthanasia only to those whose death is reasonably foreseeable. Without even appealing the ruling and seeking the advice of the Supreme Court, which has been long occupied with this matter, the Liberals accepted the ruling and now are rushing to change the law for our entire country. They gave Canadians a mere 2 weeks to have their views heard on a deeply personal and complicated issue through a flawed online consultation questionnaire. The use of the convoluted and biased language left little to the imagination in terms of how the government planned to legislate on assisted death. I too tried to fill it out, and I would argue that many opposed would have been discouraged from participating due solely to the language that was used. With such a flawed method and with no idea if the feedback even remotely reflects the actual views of Canadians, how can this government proceed with this legislation in good faith? This is a rhetorical question, Speaker, because it doesn't seem to matter to these Liberals. It's clear that they used this brief window for feedback to satiate the need for a consultative process. We also know that the government's ignored their own timeline for a review of the original assisted suicide legislation, C-14. It was planned for this summer, and instead we've been presented with this reckless legislation. In the midst of COVID, this was still something very important. Without a proper review and without input from the Supreme Court, this House has been asked to greatly broaden the scope of assisted suicide and euthanasia without a clear enough understanding of whether the current regime is being consistently interpreted or properly enforced. C7 is being rushed through, and it's concerning. When reading through this bill, there are elements that go beyond the scope of the Quebec Superior Court decision. Namely, C7 eliminates the 10-day waiting period between the date that request is signed and the day on which the procedure is carried out. The application of the law pertaining to those whose death is reasonably foreseeable has been problematic from the very start of this debate. We know that a person's reasonably foreseeable death is a flexible estimation, taking into account all of their medical circumstances without a prognosis necessarily having been made as to the specific length of time that they have remaining. The elimination of the 10-day waiting period for persons whose death is reasonably foreseeable creates the conditions for someone with an indeterminate length of time remaining in their life, possibly years, to be rushed to the decision to receive assisted suicide and euthanasia. Aside from simply eliminating what most Canadians would consider to be a reasonable period of reflection, this element of the bill also ignores the possibility of medical advances and improved treatment methods in an incredibly innovative medical science environment. As Cardinal Collins has said, C7 creates the conditions where an individual can seek a medically assisted death faster than the wait time for a gym membership or a condominium purchase. I also see no logical reason why the government would reduce the number of independent witnesses required for when the request is signed down from 2 to 1. They have even relaxed the definition of someone who may serve as a witness, including medical professionals or personal care workers, even those, Speaker, who are paid to provide euthanasia and assisted suicide on a daily basis, Clause 1.8. Surely we can agree that for the vast majority of those requesting euthanasia and assisted suicide, the requirement for 2 independent individuals to witness a request to end a life is a reasonable safeguard. How do the Liberals plan to properly protect patients from potential malpractice? How does the government plan on ensuring that requesters are presented with a myriad of treatment options rather than just one opinion? The legislation continues as a series of safeguards that the medical practitioner must adhere to before providing assisted suicide to those whose death is not reasonably foreseeable. One of these safeguards requires a medical practitioner to discuss with the person the means available to relieve their suffering, including palliative care. The safeguard is even weaker for those whose death is reasonably foreseeable, requiring the medical practitioner to merely inform the person of these vital options. The governments failed to follow through on their promise to invest $3 billion in long-term care that includes palliative care. There does not appear to be any political will whatsoever to improve palliative care. Canadians have also been calling on the government for a long-awaited national strategy for palliative care. There's a thirst among Canadians for real solutions to end-of-life care. This government seems all too willing to ignore the 70% of Canadians without access to palliative care and instead attempt to impose on them a flawed, one-size-fits-all regime. We can already see the consequences of pushing forward with an assisted dying agenda with little regard for palliative care. In British Columbia, the Delta Hospice Society was stripped of 94% of its operating budget for refusing to provide euthanasia in a facility intended for the provision of palliative care, despite repeated attempts to defend their charter-protected, faith-based objection to being required to provide euthanasia and reach a compromise in good faith. 10 hospice care beds are now at risk and will be surely defunded. Why do the Liberals continue to ignore the voices of those who have a different perspective on the issue of end-of-life care? Those who seek hospice care are seeking it for a reason, because they do not desire a medically assisted death. In effect, what's happened in BC is an attempt to redefine what constitutes palliative care. In fact, Fraser Health Authority's decision flies in the face of the Canadian Society of Palliative Care Physicians, who have clarified that euthanasia and assisted suicide is distinct from palliative care. I'd caution Canadians not to regard the Delta Hospice Society's situation as an isolated one. This government has shown little interest in supporting hospice care, and I wouldn't be surprised by further attacks on the ability of Canadians who choose to end their life naturally. In the Globe and Mail, Sarah Gray put it well. The hospice isn't a place where people come to die. It's where they come to live well for the little time that they have left. It's a place of celebration, connection, comfort, and support. It's a place of safety for the dying and the grieving. In Cardinal Collins' words, let's work to create a culture of care rather than rush towards a culture of death on demand. Mr. Speaker, the government will also be wise to recall that much of the debate on C-14 revolved around calls for a solid framework of conscience protection for medical practitioners involved throughout the end-of-life process. At committee, witnesses stated that the protection of conscience should be included in the government's legislative response to Carter versus Canada. The Canadian Medical Association confirmed conscience protection for physicians would not affect access to physical assisted suicide or euthanasia. Their statistics indicated that 30% of physicians, or 24,000 across Canada, are willing to provide it. And I live in a rural area of Canada, and I can assure you there are many provisions that are not available to me directly where I live. Unfortunately, the Liberals failed to defend the conscious rights of Canadians in C-14. I found it disappointing, too, that they failed to support in the last Parliament critical legislation put forward by David Anderson in C-418, Protection of Freedom of Conscience Act. It would have made it a criminal offence to intimidate or force a medical professional to be involved in the procedure, and to fire or to refuse to employ a medical professional who refuses to take part directly or indirectly in MAID. So here we are 4 years later, and C7 is also void of any provisions that will protect the Section 2 rights of Canadians. In Canada, everyone has freedom of conscience and religion under Section 2 of the Canadian Charter of Rights and Freedoms. No one has the right to demand all services from all providers in all circumstances. As David stated, protections are needed for doctors and healthcare providers who aren't willing to leave their core ethics behind when at a patient's bedside. Access to euthanasia and conscientious objection are not mutually exclusive. In conclusion, we as legislators must ask ourselves, where will this government draw the line? There will always be voices in our society who feel that limitations and safeguards are too stringent. When will it be enough for this Liberal government? How far are they willing to go? And what message are we sending to the most vulnerable and fragile in our society? Speaker, I've been advocating the last 5 years for our veterans, and I know there are countless veterans who appear able to cope with debilitating physical injuries, but they're extremely vulnerable in their mental health. We are all concerned about the number of them choosing to end their lives by suicide because of complications after serving our country. It's antithetical to try to prevent them from taking their own lives and yet tell them there are government-designed opportunities to do so. C7 fails to provide conscious protection, fails to protect the vulnerable, and fails to fulfill the need.
Questions et commentaires.
Questions and comments?
The honourable member for Guelph.
Speaker, and thank you to the honourable member for her intervention today, which unfortunately I found a lot of partisan comments in contrast to the member from Elgin, Middlesex, London. And I think as we look at this as a nonpartisan issue, I was visiting businesses in downtown Guelph this morning, and I spoke with one of the business owners that talked about his parents in England and how they had gone through this choice and how other countries provide ways in which people facing death can control their exit through proper legislation. I wonder if the member could comment on getting the personal comments from people that are facing those choices directly, even posthumously, as the member from Elgin, Middlesex, London presented to us, whether we could, she agrees that we should be looking at including those comments in the committee's studies, should we be able to get this to the committee.
Member for York and Melville.
I thank the member for his question. However, I would disagree in the fact that I actually totally agree with Karen. We are on the same page on this. Yes. Well noted. Member. Duly noted. The member. We're good friends. That being said, what we've done is approach it from two different perspectives. Yes, the personal, believe me, I hear those things all the time. And the concern is, at what point do you come to a decision on what is the government's responsibility? I understand we want choice. But the problem is there are not enough safeguards here for those individuals where there is a creeping into a sense that their rights and their privileges under the Charter are being challenged. And that is what I expressed here. Right now we are at the place where we are at a line between those who want a certain thing and those who do not, and someone's rights are going to be trampled if we do not deal with this very, very carefully.
Commentaires, questions and comments. L'honorable.
The honourable member for La Petite Patrie. I think that we should all agree as Canadians that we have to avoid end-of-life suffering that is avoidable. People should be able to end their lives in dignity, and we need a legal framework so that physicians can take action legally, and so they're not then reproached for having helped someone to die. Does my colleague not agree that physicians need a legal framework to be able to act in this respect?
In Melville.
Thank you, Madam Speaker. We do have a legal framework that was presented in C14. And what we're hearing now from the Canadian Society of Palliative Care Physicians is that there is creep here where palliative care facilities are being shut down because they do not feel that they should be providing assisted suicide or euthanasia, and their rights are being trampled upon. There are many, many people in our country who choose not to go that route. Their rights and their protections need to be in place as well, and that's why we need a better focus on palliative care. You can't say that you're giving people an option when they don't have an option. And this country committed, this government committed to a strategy, a national strategy on palliative care, and I believe it's our responsibility as national legislators to make it very clear that palliative care is distinct from euthanasia.
Questions and comments. The honourable member for Sturgeon River Parkland.
Thank you, Madam Speaker, and I want to thank my honourable colleague for her very moving remarks. I definitely am in full support of her remarks. I had a disability advocate call my office this past week, and she was very concerned about watering down protections for vulnerable people. And by removing the requirements on, physicians and having a physician who specializes in the area being involved, but the fact is there any provision for social workers to be involved? Because frankly, physicians are not always equipped to recognize when there might be undue family pressure or other intersectional pressures being put on the patient in order to make an assisted death call. So I just want to ask questions from my honourable colleague on what her thoughts are on that. Thank you.
Member for York and Melville.
Thank you. Great question. Yes, there needs to be a clarity in that regard. we're hearing stories, but as was mentioned, these things aren't being brought forward and prosecuted, or there aren't enough safeguards in place to make sure that people are not being coerced in that way. And I've had individuals come to me in tears over that very issue. It's becoming commonplace that this is naturally something that is offered to a lot of our individuals who are at end-of-life scenarios. Palliative care is an opportunity for individuals to live their life thoroughly to the end, along with their family. And when they make that choice, they should not be coerced. And this is something that we really need to be careful.